All right, let's talk about something that brings a ton of people into a gynecology clinic: vaginal discharge. I know it's a topic that can cause a whole lot of worry and confusion, but I promise by the end of this explainer, you're going to have a super clear way to think about what might be going on.
So you see something and you think, what on earth does this mean? And hey, you are absolutely not alone in asking that. The signs can be really confusing and it's so easy to jump to the worst conclusion. But don't you worry, we're going to break this all down together step by step so you feel totally empowered with clear info. So here's our game plan. We're going to start with the single most important clue that helps narrow things down right away. Then we'll get into decoding the most common types of discharge, peek at a few other possibilities, and then wrap up with treatments and the key things you need to remember. Okay, let's dive right in. When you talk to a doctor about discharge, the very first thing they need to know is, do you have a fever? It sounds simple, right? But this one question is a huge clue that basically splits the investigation into two completely different directions. Think of it like a fork in the road. No fever? We're probably looking at an infection in the lower genital tract, so the vagina or the cervix. But if you do have a fever, that suggests the infection might have traveled up into the upper genital tract, like the uterus or fallopian tubes. And that's a more serious condition we call pelvic inflammatory disease, or PID. So for the next few minutes, we're going to head down the most common path, the no fever route. This path usually leads us to something called vaginitis, and there are three main culprits. Let's meet them and figure out how to tell them apart. First up, we've got Candida, which you probably know as a classic yeast infection. Now, this isn't some foreign germ that invaded your body. Candida is a fungus that's normally there. It only becomes a problem when it starts to overgrow, which can happen when your immunity is a bit low, from stress, taking steroids, diabetes, or even during pregnancy. So what are the telltale signs? The classic clue for yeast infection is a white discharge that's kind of thick with a cheesy or cottage cheesy-like consistency. And this is really important, there's usually no bad smell that comes with it. That combination is a really strong hint. Next, let's talk about bacterial vaginosis, or BV for short. And, just like with a yeast infection, this isn't about a new germ showing up to the party. It's more like the party got out of hand. It's an imbalance where the good bacteria get outnumbered by an overgrowth of other bacteria, and that just throws the whole ecosystem out of whack. And this is where we see the big difference from a yeast infection. With BV, the discharge is usually more watery and there's a lot of it. But the defining feature, the dead giveaway, is the odor, a really distinct and strong fishy smell. If odor is the main complaint, BV is definitely a prime suspect. Okay, our third one is trichomonas. Now this one's a totally different ballgame. It's not a fungus, it's not a bacterial imbalance. This is a true infection caused by a tiny parasite. And because it's a sexually transmitted infection, an STI, how we treat it has a really important extra step. Now here's where it gets tricky. The symptoms of trichomonas, lots of discharge with a strong fishy odor, look almost identical to BV. That makes it super hard to tell them apart just by looking. But the most important thing to remember is this: since it's an STI, the partner also has to be treated to stop it from coming right back. Okay, let's put all this together side by side. This table makes the comparison crystal clear. You can really see the divide, right? Candida is cheesy with no odor. BV and trichomonas are excessive with a fishy odor. The real difference is the cause, and that's exactly why a doctor's diagnosis is so important. So while those big three are super common, they're not the only game in town on that no fever path. An infection of the cervix, which is called cervicitis, can also cause discharge. And, of course, we need to loop back to that fever path and understand a bit more about PID. With cervicitis, the discharge is a little different. It's often more mucus-like and might even have some pus in it. It can also cause some back pain. But the real telltale sign, the thing that makes the doctor go, aha, is something called contact bleeding. That means any bleeding that happens during sex or during a pelvic exam. That's a major red flag that the cervix needs a closer look. And we're back on that fever path. Pelvic inflammatory disease, PID, is what can happen if a lower tract infection gets ignored and decides to travel upwards. Along with that fever and discharge, a key symptom is lower abdominal pain. This is a serious condition that needs to be treated right away, because if you don't, it can lead to scarring and even cause infertility down the line. Okay, we've gone through the what, now let's get to the most important part, the what to do about it. Let's walk through the treatments for each of these conditions so you know exactly what to expect. Treating a yeast infection is usually pretty simple. The most common way is with a single pill of a medication called fluconazole, and sometimes a second pill a week later just to make sure it doesn't come back. But, and this is important, those pills aren't used during pregnancy or if someone has liver issues. In that case, local treatments like vaginal suppositories or creams are the way to go. For both bacterial vaginosis and trichomonas, the go-to treatment is an antibiotic called metronidazole, which you might know as Flagyl. You typically take it as a pill twice a day for a full week. And yes, I'm going to say it one more time because it's that crucial. If it's trichomonas, your partner has to get treated too. No exceptions. Now, with PID, the treatment really depends on how serious it is. For a mild case, a doctor might prescribe some strong oral antibiotics that you can take at home. But for a severe case, with a high fever or really bad pain, that usually means a trip to the hospital for powerful IV antibiotics to really knock out the infection.
This slide really underscores why you can't just guess at home. A doctor's exam is everything. For vaginitis that keeps coming back, they might take a swab. For suspected cervicitis, a speculum exam has to happen. And a pap smear is an absolute must if the cervix looks a little off or, and this is critical, if there is any history of contact bleeding. That's to rule out anything more serious.
And this right here, this is really the core message of this whole explainer. An infection that starts out as just a simple annoyance can turn into a major health problem if it's ignored. Listening to your body and getting professional advice early is the absolute best thing you can do.
Okay, before we finish up, let's just hammer home these final takeaways. First, if you get antibiotics, please finish the whole course. Second, if you keep getting infections, talk to your doctor about what might be causing them, like maybe an IUD. Third, remember that treatment plans are different during pregnancy. And finally, never try to self-diagnose. The symptoms just overlap too much. A professional diagnosis is the only way to be sure. Look, we hope that by demystifying all this, it feels a little less mysterious, a little less scary. Knowledge really is power, especially when you're speaking up for your own health. So think about it. With this new info, what's one new question you feel ready to ask your doctor? Thanks for joining me.